everybody, welcome back to our channel. I'm Dr. Amal from City Skin Clinic, and today we're going to be talking about the types of acne and how you can figure out what type of acne you have and then decide on the best treatment based on that. Before we get started, if you're new to our channel, welcome. Please don't forget to subscribe and ring the notification bell. And if you are an existing subscriber or an existing watcher viewer, then welcome back. As always, thank you very much for your ongoing support. Acne is an incredibly common skin condition. It's something that I see a lot in the clinic and also in the virtual clinic, and something I've personally in the past struggled with. With acne, there are different types of acne, and the different types of acne that will dictate which treatments are better and which are not appropriate. And as you know, with acne, it's often an ongoing struggle. And if you don't choose the right treatment from the beginning, or an inappropriate treatment, then that can lead to a lot of disappointment and misery, because acne and also things that acne causes like hyperpigmentation and scarring can affect someone's confidence and their happiness with their appearance. And so it is a very important condition to address, and I hope you find this video useful. So quickly, just a background to what acne is. It's a condition, it's an inflammatory condition, and it's generally caused by a couple of key things. So firstly, there is an overproduction of sebum, which is the product that the oil glands produce, and that normally lubricates the skin. It protects it and it maintains its hydration by reducing transepidermal water loss. And so if you have overproduction of sebum, and a reduced, there's also usually a reduced turnover of skin cells. And so you end up with clogging of the pores, and then that leads to a cycle of inflammation. The sebum also acts as a really nutritious source for a bacterium that normally lives on the skin and doesn't cause any problems, called P. acnes bacterium. And P. acnes flourishes in this environment of clogged pores and excess sebum. It feeds on that, and that adds to the inflammatory process. The clogged pores can then either present as whiteheads, blackheads, pustules, papules, or cysts and nodules, and what and which one of these or which combination of these happens are what you firstly see and feel on the skin, but also it also dictates what the best treatment is. There are certain things that we know tend to trigger or worsen acne. So one of them is androgens and excess or an imbalance of androgen hormones. These are normal hormones, but if there's an imbalance or there's an excess of them, then that can trigger acne, and that's why you commonly see acne start during puberty, but also it can be associated with the menstrual cycle as well. Then you also can have things like stress trigger acne. Diet is a little bit controversial. There are some triggers, but it's not very well delineated. And by irritants, that can be certain skincare products. So some people will find certain products will break them out. That can especially be using very thick occlusives in people with very oily skin, or it may be something that your skin is particularly sensitive to, or it can be active products like exfoliating acids and even retinoids at the beginning, and that's what we know of as the retinoid purge. So these are all sort of factors to consider if you have acne-prone skin. So let's get to it. The types of acne, and by that I'm going to describe initially the different lesions of acne, because these feed into whether we consider acne to be mild, moderate, or severe. So we'll start off with the first two most simple lesions, and these are called comedones, closed or open comedones, which are whiteheads or blackheads in plain terms. So comedones are when the pores are enlarge more than usual, and they become clogged up with excess oil and dead skin cells. So that's back to that initial pathological process we discussed. If that occurs but there isn't an associated hyperinflammatory state and it stays just within the pore, then what that can appear as is either a blackhead if the pore stays open and there's just the gunk inside it, or it can be a whitehead if a little closure, the pore closes up and it contains this material. They look like little whiteheads. This is the mildest form of acne, and it is the easiest to treat. So when you have these kind of acne lesions, often simple skincare products like benzoyl peroxide as a spot treatment can help, but it's not usually necessary. Usually an exfoliating acid, especially a beta hydroxy acid, which can dissolve in fat and so access the work on the pores. That will help clean out the pores. It will help increase cell turnover and reduce the incidence of whiteheads and blackheads, so these comedones, from appearing. And also, if you aren't already, then a retinoid, like a simple retinol or even a prescription retinoid, will help keep the pores open, keep the skin cells turning over, and keep your pores, your oil, and regulate your oil production. So that is what you get with these. That's the mildest form of acne. Next up is papules and pustules, which most people would probably describe as pimples or spots if you're in the UK. And so these are the raised bumps, and you often see them in acne-prone skin. It's what most people would describe as a breakout. And these can either be just red superficial bumps that you can see, and they're raised and they're a little bit tender but not massively so, but the color is either similar to your skin or a little bit red of the head. So these are known as papules, and these occur when the closed comedones, so the white head, the excess sebum and the oil that clog up the pore, start to inflame the pore, and then you start to get a bit more of an inflammatory process and the P. acnes bacteria overgrowing. So you have the P. acnes bacteria overgrowing and you get some more inflammation, and then you end up with these papules. If there is an excess in the bacteria and the debris, then these might reach ahead and turn into pustules. And these are pimples that have that little white head that people are very tempted to pop, but you shouldn't pop them no matter how satisfactory it is, because that can lead to scarring and post-inflammatory hyperpigmentation, which you don't want to deal with. So the best way to treat papules and pustules, and this is what we would consider moderate acne. The best way to treat these would be with things like, again, a regular beta hydroxy acid, using a retinoid, particularly a prescription retinoid if you're prone to these. That will help reduce the incidence of these lesions, but also it will treat any post-inflammatory hyperpigmentation or scarring that results from them. You're also you do well to try to have a benzoyl peroxide gel or a wash as your spot treatment when these appear, so that you can just dampen the inflammation quite quickly and spot treat them and reduce the size of them, and that will also reduce the temptation to pick at them or to pop them, especially if they're pus. So these are over-the-counter treatments. It's like prescription treatments, but other options can be your doctor might prescribe antibiotics, and these may help with that inflammatory process, and so a course of antibiotics for a few weeks can help some people. If these are quite severe and widespread and you get them a lot, then seeing a dermatologist for something for oral isotretinoin can help, but that's in really severe cases. Usually this can be managed with a few oral antibiotics, or even the contraceptive pill if there is a hormonal acne element associated with it, or most easily topical retinoids like adapalene, tretinoin, with simple skincare like I just mentioned. Lastly, the final two kind of types of acne are the most severe, and these are cysts and nodules. Now, remember we said that acne inflammatory process with the bacteria, with the excess sebum, the clogged up pores, clogged up with dead skin cells. If this process is ongoing, the inflammation can reach quite deep into the skin and downwards. And this actually, rather than having the pustules and papules and the closed comedones, this creates these areas of inflammation, and you get hard cysts under the skin. And so most people will say they feel these kind of slightly raised but big bumps, and they're very tender to touch. There's no head, there's no way of squeezing them or anything, but they're there, they're very visible. Nodules are very similar to cysts in that they're hard, large, deep bumps under the skin that contain this inflammatory material, but cysts also contain pus in them. So think of nodules and cysts like the advanced stages or the deeper versions of papules and pustules. And so the problem with nodules and cysts is they are very difficult to treat. They stay for a while. They generally lead to scarring, and they also can lead to hyperpigmentation. And so that makes them, the fallout from having cystic or nodular acne tends to be very textured, scarred skin, even when the breakouts reduce over time, and there may be also some hyperpigmentation from that. And so the best way, to be honest, with dealing with this, given that it's very severe acne, I would say it is to see a dermatologist. I think, of course, you should have a normal skincare routine with a prescription retinoid, but really, if you want to safeguard your skin, and you can, seeing a dermatologist as soon as possible would be the best way to manage these, because what they can do is most likely the dermatologist will put you on a course of oral isotretinoin, so that's Roaccutane, and that will firstly stop breakouts or massively reduce them, but most people find it stops it. Secondly, it will treat any scarring, it will regulate oil, so you're improving skin texture, you're improving hyperpigmentation. It's normally, this course is between 6 to 9 months, sometimes longer. And it's a real commitment. If you are of childbearing age, you will have to have submit regular pregnancy tests, because you can't be on isotretinoin if you're pregnant. So it is a bit more than applying a skincare product or even something like a prescription cream like tretinoin. But it is a really effective solution, and what your dermatologist will probably do is, after you finish the course, because this is usually something that people only do once or twice in their life and need to do, then you may continue on a prescription retinoid like tretinoin, or even just an over-the-counter to maintain your results and have a good skincare routine. So for severe acne, I really recommend, as a first step, seeing a dermatologist, and instead of letting the process kind of ruin your skin, if it's possible. But in the meantime, then using skincare products. So again, the exfoliating beta hydroxy acid is important. I think definitely a prescription retinoid is important. If the cysts and nodules are accompanied by things like pustules or papules, then a benzoyl peroxide is a spot treatment. And if there is a hormonal element, seeing your GP, they may want to start you on some the combined oral contraceptive pill or something like that, to help manage the hormones if you're female. So that would be my recommendation. Mild to moderate acne is something you can manage either with over-the-counter products or with the help of prescription retinoid creams like tretinoin, which you can easily get through online platforms, or your doctor or City Skin Clinic if you're in the UK, through our online clinic. If you have severe acne, please consider seeing a dermatologist if you can, because really they can intervene early on, and even if not early on, they can intervene in a way that really makes a massive difference to your skin. So these are what I would classify as the main types of acne. You may have come across a few other terms like acne vulgaris. This is just what we generally give the name to the most common type of acne, which is the papules, pustules, or nodules, or anything like that on the skin. And it's to differentiate it from things like acne rosacea, which can have similar appearances to acne, but there's a different process behind that. Then there's acne, hormonal acne. To be honest, I think most acne has some sort of hormonal involvement, but really generally they mean kind of sex-related hormones, so like androgens, and so with that, often you might notice breakouts during your menstrual cycle, or if starting a progesterone only contraceptive. And so for that kind of acne, things like the combined oral contraceptive pill might be useful, or stopping triggers, hormonal triggers that cause it. So it's important from that perspective. And then there are things like acne mechanica. So that's really honestly what I would call things like the causes of back acne or body acne. And it's usually acne caused in places like the back or the arms. Part of that is obviously the process of skin not turning over well, but also part of it is kind of being sweaty, especially if you're very active, and clothes that kind of rub against the skin. And so that process, along with that humid environment, can cause that type of acne. And the best way to deal with that is through body washes that contain salicylic acid and even benzoyl peroxide. It's making sure that your gym clothes are clean and they're breathable. And last but not least is acne conglobata. Now, thankfully, this is very rare, but it's a form of nodular acne where the lesions interconnect underneath the skin and create this kind of vast network, and that leads to really extensive, horrendous scarring. So this is another reason why I think if you have cystic or nodular acne, to see a dermatologist early on so that they can figure out exactly what's happening and put you on the best, most powerful treatment, especially if they suspect something like acne, conglobata, or even just nodular and cystic acne, which can wreak havoc with your skin. So I hope you found this video useful. If you liked it, please give it a thumbs up. If you have any questions, leave a comment below. I'm also going to leave a link to our blog that goes into this subject in more detail, and a few pages from our website, a few guides to acne and acne scarring that I think you might find useful. And if you haven't already done so, don't forget to subscribe to this channel and hit the notification bell. Until next time, stay beautiful. And last but not least is acne conglobata. Now, thankfully, this is very rare, but it is a form of acne, a nodular acne, where the lesions It's a form of nodular acne where the lesions interconnect underneath the skin and create this kind of vast network, and that leads to really extensive, horrendous scarring. So this is another reason why I think if you have cystic or nodular acne, to see a dermatologist early on so that they can figure out exactly what's happening and put you on the best, most powerful treatment, especially if they suspect something like acne, conglobata, or even just nodular and cystic acne, which can wreak havoc with your skin. So I hope you found this video useful. If you liked it, please give it a thumbs up. If you have any questions, leave a comment below. I'm also going to leave a link to our blog that goes into this subject in more detail, and a few pages from our website, a few guides to acne and acne scarring that I think you might find useful. And if you haven't already done so, don't forget to subscribe to this channel and hit the notification bell. Until next time, stay beautiful.